Hello everyone, I'm Rajalekshmi. I understand the critical role accountability plays in healthcare leadership. Focus on accountability in healthcare doesn't always bring the desired results. It often becomes linked with failure, making people feel responsible only when things go wrong. This creates hesitation as individuals fear taking action due to the risk of being blamed. Instead of solely concentrating on accountability, shifting the focus to responsibility encourages positive actions and development. This challenge is especially important for healthcare leaders who must manage complexities of accountabilities, particularly with the younger generation entering the workforce. So today, as a team, we want to share a real-life case scenario that presented a significant ethical challenge illustrating the complexities of professional responsibilities. Emily, our colleague, a newly licensed psychologist, had joined a counseling center under the supervision of Dr. Moore, a senior psychologist who typically handled complex cases. So during Moore's absence, a 15-year-old client, Daniel, came in for an emergency session. Daniel, with a history of depression, admitted to stopping his medication and experiencing thoughts of self-harm. Without immediate senior guidance, Emily was faced with critical dilemma: how to respond effectively while staying within her professional scope. Objectives of our study: examine the ethical dilemmas, investigate the challenges faced by early career mental health care professionals when handling complex client situations without senior support. Second one, highlight the role of support. Emphasize the importance of providing adequate guidance and empowerment to healthcare leaders and junior staffs for effective decision making. Assess accountability and responsibility. That's a third one. So analyze the balance between accountability and responsibility in healthcare, especially in high pressure scenarios, and how it affects decision making. Explore core of actions. Evaluate potential actions for Emily and the case implications.
Now we are talking about her responsibility as a new psychologist. The boundaries of her assistant job was critical, particularly when handling high-risk scenarios. For example, she had to strike a compromise between her obligations to patient and her awareness that she need further help from a senior psychologist. Decision: should she try to handle everything by herself to maintain patient trust and confidentiality, or should she involve someone more experienced, potentially breaking that trust by involving external help? This wasn't an easy choice. As reaching out could be seen as a violation of patient's privacy, which is a crucial part of the therapeutic relationship. But at the same time, patient safety comes first. So after thorough assessment of his mental state, she decides patient safety comes first and then takes steps to involve appropriate professionals. Senior doctor also recommended that notifying patient parents would be one of the most important steps that she have to take. But importantly, this was done with the patient consent, which is key in respecting his autonomy while ensuring he got the support he needed. These choices shows professionalism and accountability in the face of difficulty. Not only did she recognize her limits, but she also prioritized patients' welfare by asking an experienced colleague for advice. This upholds the moral perspective that psychologists should seek, assist rather than endangering their client safety when they are unclear.
Let's talk about the consequences and reflection. Here are some key points. Positive outcome from prioritizing safety, the client's initial reluctance to overcome, the professional intervention improved care, Emily's personal and professional growth, redefinition of accountability. Now let us analyze the consequences that happened to Emily and our reflection regarding the situation. Emily made the right decision to prioritize Daniel's safety, which had a positive impact despite his initial reluctance to include his parents. Daniel eventually relented, understanding that his situation was severe. The professional intervention resulted in tangible benefits, like the psychiatrist changed Daniel's dosage of medication and arranged for a more comprehensive treatment, which would help him shortly. This experience was life-changing for Emily. She understood that she needed to ask for help, which was somewhat hard for her, despite if it meant moving out of her comfort. This case proves that it is possible to turn a problematic situation into an enriching lesson for a psychologist, thus this influencing her future performance in complex cases.
We summarize after listening to Daniel's case, in which Emily, as a psychologist, faced some safety issues for the patient and she put him forward before taking any decision by herself. She understood her responsibility and accountability in decision making. She did not only reach out to her senior, as well as she included his parents and psychiatrist in the situation, and the positive results does not only indicate that she was responsible and accountable in whatever decision she made, but it also underscored that being accountable does not only means answering all the time, but knowing where my limits are and where I should ask for external help. This case study gives us a clear and systemic approach of encouraging teamwork and using communication in its best effective way so as to get the desired result without affecting any bad impact on the client and putting the patient first, even at the risk of challenging trust. Thank you.